Coccidioidomycosis, more commonly known as valley fever, is a fungal infection that can wreak havoc on your health. This infection primarily targets the lungs, causing a range of symptoms from mild discomfort to severe respiratory distress. Unlike many common infections spread through person-to-person contact, valley fever is acquired from the environment. The culprit? Microscopic fungal spores lurking in the soil, primarily in specific regions of the Americas. Imagine inhaling these tiny spores while engaging in everyday activities like gardening or construction work. While most people exposed to the fungus experience no ill effects, some develop mild flu-like symptoms that resolve on their own. However, for individuals with weakened immune systems, valley fever can pose a significant threat. This essay delves into the intricacies of valley fever, focusing on its impact on immunocompromised individuals. We'll explore the regions where it's most prevalent, the telltale signs of infection, and the challenges in diagnosing this often silent invader. Furthermore, we'll discuss available treatment options and emphasize the critical importance of early detection in improving outcomes for those most vulnerable to this potentially debilitating disease. Valley fever is a master of disguise, often mimicking the symptoms of other common ailments. This makes it tricky to diagnose, especially in the early stages. Imagine feeling a general sense of fatigue accompanied by a persistent cough that just won't quit. You might dismiss it as a common cold or a touch of the flu, but these could be the initial whispers of valley fever. As the infection progresses, the symptoms can intensify. Fever might grip your body, sending chills down your spine. Chest pain can develop, making each breath a struggle. In some cases, a rash might erupt on your skin, a telltale sign of the body's battle against the fungal invader. However, valley fever's symptoms aren't set in stone. They can vary greatly from person to person, making it even more challenging to pinpoint the cause. For those with weakened immune systems, the symptoms can be more severe and even life-threatening. This underscores the importance of being vigilant about your health and seeking medical attention if you experience any unusual or persistent symptoms, especially if you live in or have traveled to an area where valley fever is endemic. Section 5. Diagnosis: Unmasking the silent invader. Diagnosing valley fever is like playing a game of medical detective, piecing together clues to unmask the silent invader. The challenge lies in the infection's ability to mimic other respiratory illnesses, making it easy to overlook, especially in the early stages. Doctors rely on a combination of tools and techniques to crack the case. Blood tests are often the first line of defense, searching for specific antibodies produced by the body in response to the fungal infection. However, for those with weakened immune systems, these antibody levels might be low or delayed, making the diagnosis even trickier. In such cases, more sophisticated tests, like culturing the fungus from a patient's sputum or tissue samples, might be necessary. Imaging studies, such as chest X-rays or CT scans, can also provide visual clues, revealing the extent of lung involvement or the spread of infection to other organs. This diagnostic odyssey highlights the importance of open communication between patients and healthcare providers. Providing a detailed medical history, including any recent travel to endemic areas or underlying health conditions, can provide crucial clues that guide the diagnostic process. Section 6. Combating valley fever treatment strategies. Once the valley fever diagnosis is confirmed, the battle plan shifts to combating the fungal invader and preventing further damage. Antifungal medications become the weapons of choice, targeting the fungus and halting its relentless march. The first-line treatment typically involves oral antifungal medications like fluconazole or itraconazole. These medications act like guided missiles, disrupting the fungus's ability to build and maintain its cell walls, ultimately leading to its demise. However, for individuals with severe or disseminated infections, especially those with weakened immune systems, a more aggressive approach might be necessary. Intravenous antifungal medications such as amphotericin B are often employed in these critical situations. While highly effective, these medications can have significant side effects, requiring careful monitoring and management by healthcare professionals. The duration of treatment can vary depending on the severity of the infection and the individual's overall health status. Some individuals might require months of antifungal therapy, while others, particularly those with compromised immune systems, might need lifelong suppressive treatment to prevent the infection from rearing its ugly head again. Section 7. Shielding yourself from valley fever. While there is no foolproof way to completely eliminate the risk of valley fever, especially in endemic areas, there are steps you can take to fortify your defenses and minimize your chances of encountering this silent threat. Imagine building a protective barrier between yourself and the lurking fungal spores. One of the simplest yet most effective measures is wearing a mask, especially during activities that disturb the soil, like gardening, construction work, or even hiking in dusty areas. Think of it as wearing a miniature air filter, trapping those tiny spores before they reach your respiratory system. If you live in an area where valley fever is prevalent, staying informed about local weather conditions, particularly wind and dust storms, can also be helpful. These events can stir up a whirlwind of fungal spores, increasing the risk of exposure. During such times, limiting your outdoor activities or opting for indoor alternatives can be a wise decision. For individuals with severely compromised immune systems, such as organ transplant recipients, prophylactic antifungal medications might be an option. These medications act as a preemptive strike, reducing the risk of developing a severe infection. However, the decision to use prophylactic medications should be made in consultation with a healthcare professional, weighing the potential benefits against any possible side effects. Section 8. The importance of early detection. In the battle against valley fever, time is of the essence. Early detection is paramount, especially for individuals with weakened immune systems who are at a higher risk of developing severe and disseminated infections. Think of it as a race against time, where early diagnosis and prompt treatment can mean the difference between a mild illness and a life-altering complication. The challenge lies in valley fever's often subtle presentation mimicking the symptoms of other common ailments. This makes it easy to overlook or misdiagnose, leading to delays in treatment and potentially allowing the infection to gain a stronger foothold. This underscores the importance of being proactive about your health. If you live in or have traveled to an area where valley fever is endemic and experience any unusual or persistent symptoms, especially those related to the respiratory system, don't hesitate to seek medical attention. Early diagnosis, often through a simple blood test, can pave the way for timely treatment and a better chance of preventing serious complications. Remember, knowledge is power. Understanding the risks, recognizing the symptoms, and seeking prompt medical care are crucial steps in protecting yourself and those you love from the silent threat of valley fever. Section 9. Conclusion: Navigating the Valley of Fever. Valley fever, with its elusive nature and potentially severe consequences, can seem like a daunting challenge, especially for those with weakened immune systems. But armed with knowledge and vigilance, we can navigate this valley of fever and emerge stronger on the other side. Understanding the geographical distribution of this fungal infection and recognizing the activities that increase exposure risk are the first steps in building our defenses. Being aware of the common symptoms, though often subtle and easily mistaken for other illnesses, is crucial for early detection. For individuals with compromised immune systems, this awareness becomes even more critical. Their vulnerability to severe and disseminated infections underscores the importance of proactive healthcare, including regular checkups, open communication with healthcare providers, and prompt medical attention at the first sign of trouble. While the journey through the valley of fever might be fraught with challenges, remember that you are not alone. With awareness, prevention, early diagnosis, and effective treatment strategies, we can mitigate the risks and improve outcomes for everyone, ensuring that valley fever doesn't cast a long shadow over our lives.